Good evening, good afternoon, and good night to whoever is watching. Let's begin our today's class, and it's about osteoporosis. Also, one of my subscribers told me that they're having a problem seeing me write the pencil one. I'm going to use something different today. I'll try and include something that is very good at understanding, and at the same time I will include tips. Thank you for guiding me. So without any further ado, let's get started. I like to keep everything very traditional, at the same time fun kind of thing. That's the main basic way why I want to use these colors, and I feel like it is good at encoding our memory, enhancing our memory with these colors. So that's the basic idea behind my video sessions. Okay. So what is osteoporosis? It is a trabecular and cortical bone loss. That means there is cortical loss as well as the trabecular loss. But there is something normal in this. If we go with the serum calcium levels or serum phosphorus levels, it is normal, meaning the bone mineralization is absolutely fine. It happens with increasing age, menopause, where estrogens are lost and the body's protective mechanism to the bones is also reduced. This can also happen with several other factors. Medicines, alcohol is a big one. Okay. So usually we have to do the screening test. So the screening test usually starts from 65 or above 65, and we do the DEXA scan. If the DEXA scan is less than minus 2.5, it means there is osteopenia and we need intervention at this point. So most of the times the less than minus 2.5. So sorry about that. So whenever there is a fall, let's say a trivial fall, it can lead to fracture. That is because the patient has concomitant osteoporosis. It's not because of the fall, actually. Mainly, if someone asks you, what can we do, doctor? How can we prevent this? It's based on prophylaxis. Okay. Ask them to do weight bearing exercises, regular weight bearing exercises. This may include a swimming and walking, cycling, and so on. Okay. Help them take a good adequate diet that is rich with the calcium and vitamin D, because both these go hand in hand. Okay. And finally, if there is very severe, meaning if the two discs are undergoing fractures, meaning this is one of the most common complications, and this is what we call as the compression fractures, which can lead to loss of height, kyphosis, and lot of other complications like low back pain. Okay, most of the times it will be elderly women with a low back pain, and you may want to think this as one of your differentials. And sometimes they can have fallen outstretched hand. Even a small trivial injury could lead to Colles fracture. Okay, so we'll do the X-ray and make out. And then there is something very important, and that is when to give bisphosphonates. Bisphosphonates are the first line treatment. We want to make sure the patient is upright while taking this, and also think about giving loads and loads of water when the person consumes bisphosphonates like alendronate. There is increased risk of jaw necrosis over time. So the person has to sit upright for 30 minutes during the injection of such medicines. Um, we also rarely give something called as denosumab. And this is given when the is very severe osteoporosis. This is targeting against rank L receptors, that is the osteoclast. Literally kills out all the osteoclasts. And we know that osteoclast means bone resorption. Okay. It is very simple topic and so very, very important to note.